My name is Grant Wood. I'm the co-founder of Align Clinic in San Mateo, California. I first learned about the Chenoo brace in 1995. I was a student at University of Salford in England, and I heard about an opportunity to go to Spain for my fourth year clinical residency. Sounded like a good idea. Went to Spain, met my wife, got married, lived there 8 years. In 1996, I went to Barcelona to do a course with Dr. Chenoo and by Dr. Rigo at Elena Salva Institute. There, I learned about the Chenoo brace and its asymmetrical shapes and three-dimensional designs, and was really interested in knowing more. Did that workshop in Barcelona. A few months later, Dr. Chenoo and Dr. Rigo came to Sevilla to train us again in a workshop there, a whole week-long workshop. And after that, at the end of that course, we had the first Chenoo brace conference in Seville at the Hospital Virgen de Rocío, June 6, 1997. And the three girls that Dr. Rigo fit with the brace walked out in their braces in front of the whole, must have been 100 people, medical professionals in their conference room, conference center in the hospital. Walked out, brave, fearless, went up on stage, and Dr. Chenoo described the biomechanics of it and did a great job. And, this was the first time that those professionals there had seen this brace. And it's a little bit like how it was in Spain 20 years ago is a little bit how it's been here in the United States during the last few years. As far as back then in the 90s, there were some people that were skeptical or non-believers, but as they got to see the brace more and the function of it, they started to support it more. So Dr. Chenoo and Dr. Rigo would go back and forth between Barcelona and Sevilla, training us, and then we would go to Barcelona to be trained all through the late 90s. And in 2003, I moved back to the United States. In the last 6 years in the Align Clinic, we've been seeing patients there for scoliosis, continuing with the Rigo Chenoo type brace that we have in Align Clinic with the team there. We did our first clinic outside of San Mateo, one of the first ones in Boulder, Colorado, then in New York with Mike Mangino, and we trained the orthotists there. They became certified, and so now we have quite a few different clinics and satellite clinics that are either hosted by certified WCR orthotists throughout the United States or hosted by a physical therapist, usually a Stroth or BSPTS Stroth therapist will host a WCR clinic, and one of the certified orthotists will be there and be able to see the patients and fit the brace. My name is Grant Wood. We provide the WCR brace for patients with scoliosis, many different types from infantile, juvenile, and adolescent idiopathic scoliosis, as well as for adults and neuromuscular conditions. So each brace design is different for each one of those patients. We use the Rigo classification in our design. I learned the brace in Spain, lived there for 8 years, and it's a concept that we've continued to learn every year, practice, and we can provide this for our patients. WCR brace is a three-dimensional brace that corrects the scoliosis in not just 3 planes, but also dividing each block of the patient's body into, following the Stroth blocks, into separate sections. And then from there, we can evaluate what we need to correct on each section from derotation, translation, and sagittal plane normalization. So the concept is that it works off elongation, derotation, and deflection with providing sagittal plane normalization. This, in my opinion, gives an optimal three-dimensional correction of each patient. No matter what the brace design is or the name of the brace, it's important that not experience, but the capability, the skill of the people that are taking the process, the scan, the measurements, the fitting, the manufacturing part, which is a modification of the brace, and then once you fit the brace, then the follow-up. What do you do when you see the x-rays? What do you do when they come in for a follow-up? How do you adjust the brace to make it better to continue providing optimal treatment? So it's the whole process that's important. It's just not getting a brace, putting it on, fitting it the best they can, and then not being able to problem solve or identify exactly the point that needs to be adjusted to make it fit the best it can fit and the best it can function for each patient. So I think we've been doing this I started in 1996, 1995, 1996. I lived in Spain for eight years, and each month I'm learning something new. And it's just an evolving learning process that is very hard to just learn in a few years. It requires, in my opinion, a team of people that work together to be able to communicate together, to be able to identify each situation, each fitting, each follow-up, and make the adjustments and fit it the way that's best for each patient's body and diagnosis. The WCR brace is a three-dimensional brace that we provide at Align Clinic. It's a wood Rigo Chenille brace. This is the original design was from Dr. Chenille, then followed by Dr. Rigo using the Rigo classification, and then it's my personal version of what I've learned from them throughout the last 20 odd years. And that's what we provide at Align Clinic, is that we have a team that's built up of many orthotists that have been highly trained for many years. And we have a standard of care that I think is at a high level that, in my opinion, can provide the best treatment available. I think one thing that's important to understand, it's not a guarantee of any result. So I don't think you can say, how much correction can we get? You know, we don't know how much correction we can get. We know that we can provide the best that we can make for each patient and do the best we can do. Then it depends on a lot of other factors, you know, how the body adjusts to the brace, how much structural changes to the spine, how much the patient wears the brace, how you know, the participation between the patient and the parents with the follow-ups, and the ability to assess the x-rays, to assess the fit during the whole timeline of the fitting and wearing of the brace. So there's many factors to success of bracing. It's just not getting a brace with a certain name and then that guarantees a result. It's more than that. It's just the brace is about the complete process of the evaluation to the fit, the follow-up, and the team that's there to be able to identify each part of that process.